Welcome all. Today we'll see a topic papilloma in the chapter of swellings. So this is a 5-mark question and also can be asked as a 2-mark. So first we'll see what is the definition of the papilloma and what is meant by a true papilloma and what are the types of papilloma and the differential diagnosis and the treatment. So first, what is papilloma? The definition is, it is warty swelling from the skin or often from the mucous membrane. It is just a swelling that resembles like a wart from the skin or from the mucous membrane. So as you can see here in this picture, it has a central axis and this central axis contains connective tissue, blood vessels and lymphatics. It is pedunculated mostly, so it contains a peduncle. And imagine this as the wart-like swelling. Through this, it contains connective tissues and blood vessels and lymphatics. All these things are present. So this is no papilloma. So first, what is a true papilloma? True papilloma in the sense, it contains overgrowth from all the layers of the skin. That is epidermis, dermis and hypodermis. All the layers of the skin are overgrown and it is a benign tumor. It is not a malignant one. And it is pedunculated. So true papilloma in the sense, it is a benign tumor with overgrowth of all layers of skin and it is pedunculated. So it contains all layer of skin. It contains sweat glands, sebaceous gland and hair follicle. Usually the components of this skin include sweat glands, sebaceous glands, hair follicles. So here also true papilloma contains sweat glands, sebaceous gland and hair follicles. Coming to the classification, papilloma may be cutaneous or mucosal papilloma. So cutaneous papilloma is further divided into squamous cell papilloma and basal cell papilloma. So first is the squamous cell papilloma. Squamous cell papilloma is a congenital one, and where it occurs is occurs in the eyelids of elderly people. It is a soft papilloma. It may contain stalk or it can be sessile. So it is pedunculated or sessile. It can be single or multiple. So next is the basal cell papilloma. So the basal cell papilloma is a brownish raised seborrheic keratotic lesion. This is nothing but it is a brown color lesion. It is keratosed and it contains discharge of sebum from it. So this basal cell papilloma is oily, semi-transparent. Basal cell papilloma is brownish raised seborrheic keratotic lesion. The lesion is brown in color and it is keratotized and it is raised from the surface and contains sebum as a discharge. So this basal cell papilloma seems oily and it is transparent, semi-transparent. As it contains oil, it is semi-transparent and it occurs in the skin around the trunk of an elderly people. So papilloma, it is of two types, cutaneous and mucosal papilloma. Cutaneous papilloma is squamous cell and basal cell. Squamous cell papilloma is a congenital one and it occurs in the eyelids of elderly people and it may be pedunculated or sessile, single or multiple, and it is a soft papilloma. And basal cell papilloma, it is a brownish lesion which is keratotized and it is a seborrheic, that is the discharge of sebum is present. So it is oily and semi-transparent and the skin around the trunk of the elderly is a common site for the basal cell papilloma. So this papilloma may be single or multiple, pigmented or non-pigmented papilloma, pedunculated or sessile papilloma. So next, this true papilloma can suddenly turn into a squamous cell carcinoma. This is a malignant condition. It may turn into a squamous cell carcinoma and causes sudden increase in size and bleeding, ulceration may also be present. When true papilloma suddenly increases in size and there is a presence of bleeding and ulceration, it is suspected for a squamous cell carcinoma. It is a rare condition, but it is also a complication. So next, types of papilloma, forms of papilloma. Next is the different papillomas. First one is the ductal papilloma. Ductal papilloma occurs in the breast and the common cause of bloody discharge from the nipple is the ductal papilloma. Common cause of bloody discharge from the nipples is the ductal papilloma. Transitional papilloma. So transitional papilloma is present in oral cavity and urinary bladder. So transitional papilloma arises from transitional epithelium. Transitional epithelium in the sense it is made of stratified epithelium. It is made of more layer of cells and it is capable of stretching. So imagine urinary bladder. Urinary bladder is actually made of transitional epithelium. It can withhold stretching. So the papilloma arising from the oral cavity and urinary bladder is a transitional papilloma. Next, columnar papilloma arises in rectum. columnar papilloma arises in rectum, and rectum contains columnar cells, and a cuboidal papilloma arises from larynx and gut. Infective papilloma, it is a warty lesion due to the infection. Example, it is due to the infection of condyloma acuminata. So next, differential diagnosis. Differential diagnosis includes amelanotic melanoma. Amelanotic melanoma is a rarest form of skin cancer. Here melanin production is affected and there is no melanin in the type of melanoma. So it appears in the skin color or pinkish color, and it is a differential diagnosed for lipoma. And pedunculated lipoma and carcinoma. Complications include bleeding from the papilloma, malignant transformation of the papilloma. As I said earlier, true papilloma can progress into a squamous cell carcinoma, and next one is ulceration of the papilloma. So treatment. True papilloma is excised with its base plus surrounding 1 cm skin margin. Along with its peduncle, the whole papilloma is excised with its base and also the 1 cm skin margin. Next, infective warts. Infective warts, the treatment is excision.